Yeah, so the IMerge was a phase III trial which investigated Imetelstat, a first-in-class telomerase inhibitor, in patients with low-risk MDS, according to the IPSS low, intermediate 1, versus placebo. There was actually a 2-to-1 randomization. And apart from the IPSS, one inclusion criteria was also a transfusion burden of at least 4 units of red blood cells within 8 weeks. So majority of patients actually had a high transfusion burden. Also, ESA therapy was required, and also failure to ESA therapy was required. So basically, the trial included a typical lower risk MDS population with a high transfusion burden. And also the median age and everything like this, I think, resembled very well a typical MDS cohort of patients. The trial actually met its primary endpoint, which was red blood cell transfusion independence of at least 8 weeks. There was a statistically significant difference with almost 40% response rate in the Imetelstat arm. Apart from, I think, the neutropenia and the thrombocytopenia, which is a known side effect of Imetelstat and could be managed pretty well in the majority of the patients with no dose delays, the trial basically did not reveal any new safety signals. There was also a translational work presented at the EHA meeting, which showed that patients with a known mutation like SF3B1 or DNMT3A actually had a decline, a significant decline, sometimes by 100%. Of the allelic burden of the mutation, which shows that the drug has obviously disease-modifying activity. And actually this reduction or this affection of the clonal cells also correlated with the clinical response. So to make a long story short now, we hope that the trial will result in the approval of this agent for low-risk MDS patients failing first-line therapy within ESA.